Pleasure of introducing Professor Rifat Atun, who is joining us today. Rifat is a key academic partner of the Global Innovation Hub and is the lead for our joint project on accelerating value-based healthcare in the G20 plus nations. Professor Atun is the Professor of Global Health Systems and the Director of the Health Systems Innovation Lab at Harvard University. More than that, he's a friend, a colleague, and a partner. So welcome, Rifat, and thank you for joining to provide a sneak peek into this exciting project.
Yeah, thank you, Ebele. And the presentation by Love Agarwal, which was very comprehensive and very clear, provided a very good segue to this presentation. Because as you'll recall, at the G20 presidency of Saudi Arabia, one major priority was high-value health systems, and the second was digital health. And actually, we saw digital health as underpinning high-value health systems to develop resilient and sustainable health systems going forward. And but one very important question that emerged from the Saudi Arabia presidency was, what do these high-value health systems look like? In fact, what is a high-value health system? So what we seek to do in this study is to try and understand where countries are in relation to high-value health systems and provide an overview of what a high-value health system might look like. Now, I'm using the high-value health system specifically because this differs from value-based healthcare, which tends to be institutionally based. In order to develop a resilient and sustainable health system, one has to transition from institutional level initiatives to system-wide initiatives, as our colleague from India, Love Agarwal, also identified. So scale is critically important. So what we intend to do, next please, intend to do in this study is to try and understand how G20 countries are transitioning to high-value health system model. And we've been working over the years looking at experiences in different countries and have developed a framework which identifies 10 components that need to be in place to transition to high-value health systems. And we've written a number of case studies, including several from G20 member states. And as Ebele mentioned in the recent course at High Value Surgical course, we've applied this model to the course, and I think it worked very well, and it resonated extremely well with participants at the course that included high-level individuals from 30 plus countries. So the objective of the study is to use a literature review as well as a series of interviews and case studies and the mapping exercise to develop an evidence base to understand where countries are in relation to a high-value health system, and then benchmark how countries compare against each other. And in this process, try and understand what are the enablers that have enabled countries to transition to along each of those components to high-value health system model, but also the barriers that need to be overcome. And using case studies and interviews to learn what needs to be done to transition to high-value health systems so that we can develop a pathway for stakeholders who are designing or who are accelerating transition to high-value health systems to implement different approaches. Next, please. So the methodology is a desk review of the current evidence in terms of different approaches used to ascertain if countries are transitioning to high-value health systems or not, and a position paper to inform the analytical work. Secondly, a survey that will involve the G20 member countries that consists of 32 qualitative and quantitative indicators, followed by interviews with experts from G20 countries, and then based on the survey, using a scoring and the spider web to try and ascertain where countries are in relation to each of those components. Again, this is not to rank countries, but purely to identify where countries are and then develop potential strategies to help them progress. And finally, develop a series of case studies of good practice to learn lessons from the journey to transition to high-value health systems. So we look forward to your collaboration in this process, and we hope that we might be able to present our findings in the meeting in Goa in India